All right, back to school can mean anxiety for our children.
Yeah, so what can we do to ease their minds? Dr. Tim Kearney from Community Health Center is here to talk more about it.
How are you, Doc?
I'm great. How are you today?
We are excellent. I want to start off with this quote that you gave. I think it was the Hartford Courant. In my 23 years at CHC and 40 years in the behavioral health field, I have not seen anything quite like this. Talk to us about what this is and the problems that we're facing.
Sure. Be glad to. This is the pandemic, of course, and the reality that not only are our kids facing all the challenges that they are facing, but all of us as adults and people who care for kids are facing them alongside with them at once. So it's a situation where even the helpers are needing help and struggling with being able to give help to the kids that we would normally really try hard to be there for.
Yeah, and what kind of advice do you have for parents to talk to their children, because they're seeing them at home so much now? Maybe they might not recognize some of the signs of anxiety or see that they're getting a little nervous heading back, back to school again.
Yeah, I think that's a really good point, because a lot of kids may not be opening up readily to talk about what's on their mind. So that as parents, what we can do is, we know our kids. Look at what's different. Is there something showing up that didn't used to be there? Things like, everybody's going to be anxious or nervous or concerned right now because it's a lot to be anxious and nervous about. And you might see some depression because there's been a lot of changes in people's lives, losses, things that are different than they used to be, people being sick, some cases people have died from COVID. So all that stuff's going on. But specifically looking for things that are interrupting a child's ability to function well in life. It might be sleep disturbances. It might be talking about things that they're worried about. It might be more signs of withdrawing. It might be really anything that's different than what they used to be. So keep your eyes open and then take seriously what they say that they're nervous about, because there is a lot to be nervous about right now. Right. And try to find out exactly what it is so that you can give them some up-to-date information.
And you say, don't be afraid to ask for help. Mental illness has still that stigma attached to it. And I'm not saying that this is a mental illness, but this anxiety, don't be afraid to ask for help. It's just like anything else, right?
Yeah, absolutely. And it is so easy to feel like we have to do it on our own.
Right.
That there's, that we can't reach out. And you're absolutely right. I would encourage people to reach out to their primary care providers. Some, like us, have behavioral health people built right into the primary team. But even if they don't, your primary care provider knows the resources in the community. Or reach out to the folks at your school when schools start getting started again, and they can point you in the right direction.
Okay.
All right, and speaking of back to school, we know we've heard the mask mandate for the first 30 days. That can be a volatile conversation for everybody. We can't get it. I don't want to get into that part of the conversation, but do you have any templates or structure for parents to talk to kids about the masks? Because that, it is what it is. It's on people's minds. So any suggestions?
Yeah, you're absolutely right. There's a wide range of responses to that among parents and kids both. And, I have to be upfront about my own bias. I'm a professional who works with kids. And my first thought is, how do we keep kids safe? Mm-hmm. And there's so many kids that are too young to be vaccinated, but they are hearing all the time about how important the vaccination is. And so my first thought is, how do we keep them safe? And to talk to the kids at a time where there's so much anxiety and so much that isn't under control, about what can they do to help keep themselves safe. And one of the things that we know can help keep them safe is wear a mask, wash their hands, follow the social distancing guidelines, all those various things that we're probably all kind of tired of doing, but they're still important to do. So I would talk to kids about that. If they have fears, anxieties, resistances to it, again, try to find out specifically what the fear is. The more you can name a fear, the less power it has. And then from there, try to help them figure out what can they do. What do they possibly have some control over?
And, it's interesting here. You say, while one child might become withdrawn, another might suddenly become more extroverted. And that could be a problem as well, right? Any of these changes, you should really be paying close attention to.
Yeah, that is so true. Especially, if you have more than one child in the same family. It's always fascinated me that kids that come from the same genetic material, and kids that live in the same environment can respond so differently to the same situation. And so the factor, exactly as you're saying, is, has it changed? And has it changed in a way that is interfering with the child's ability to do well in the various parts of their life that they're involved in?
All right. Well, thank you so much,
Yeah.
Dr. Tim. We appreciate you. We both love your glasses, by the way.
Yes.
Well, thank you. I appreciate that. It's a pleasure to come, and I hope it's been helpful to people.
Yes, you certainly were, and we appreciate your time and spending it with us on Better.
Yeah, I know. Kids so important, right? Well, geez.